support to very many people who were successful because of him, both with their publications and their grant applications. And so since Sam is in retirement, we figured we would tap into his having extra time on his hands to come back and share with us really, I think, a very important topic that we don't talk about enough. We all use a lot of surveys in our research. Oftentimes we're using existing instruments, but sometimes we are creating our own new instruments, and we really do need to pay particular attention to the reliability and validity of these instruments, because we're using them to put what we hope is generalizable information out into the public sphere. So Sam will be talking to us today on designing, evaluating, and revising a survey. So Sam, thank you very much for joining us today, and I will turn off my mic and turn over to you.
Okay. Thank you for inviting me to do this. Let me see if I can bring up the PowerPoint here. Okay. Are you seeing the PowerPoint now?
Yes, but it is not in presentation mode, Sam. So
Oh, yeah.
if you want to put it in presentation mode in your right, where you have right there, a little bit to the left, right there.
Okay.
Yep, perfect.
Okay. So so I decided to broaden the topic a little bit, not just focus on reliability and validity assessment. Sorry for my throat clearing. There's way more to talk about than will fit in this brief tutorial, but I'll be highlighting issues and kinds of problems that I've run into when I analyze survey data over the years, and with a few ideas here and there about ways of maybe preventing some of the problems or reducing the problems, and evaluating them and fixing them in some cases. So so I'll be talking about the certain kinds of things that can go wrong. Again, prevention, evaluation, and fixing. So just sort of to have some examples handy to talk about to illustrate some points. I'm only going to be focusing on quantitative kinds of estimation that we'd like to do in surveys. And by survey, I really mean a survey, a questionnaire where someone is being asked to self-report on some aspect of their life, their professional life. It could be a survey that's conducted on patients in the community. It could, or in a clinic. It could be other people in the community who aren't necessarily patients. It could be a survey of healthcare providers, anything like that, really, as long as it's people answering, self-reporting on questions, or talking about their beliefs or knowledge, or similar quantities. So in this case, just made up some examples here. So one category of quantitative question is simply estimating a quantity, like a proportion or a mean. So, what is the self-reported PrEP adherence level 1 year after starting to use PrEP? That would be a question in a particular subpopulation. For those who are conducting research, have an existing study going on, perhaps you'd like to add on a long-term follow-up or some sort of sub-study. And a question there might be, what proportion of the patients who are enrolled in the study would agree to enroll in a separate long-term follow-up? maybe questions on how much of a financial incentive might be required to induce them to actually participate in a long-term follow-up or another study of some sort. So again, the focus there is on estimating proportions or means, typically. And the other use for surveys that's pretty common is to actually test hypotheses or research questions that involve looking at the association among variables. So, so I just came up with this idea this afternoon for a study. Among people prescribed PrEP treatment, what is the association between initial rapport with their provider team and 1-year PrEP adherence, where presumably greater initial rapport is associated with greater PrEP adherence, 1 year later. That the idea for this came from, by the way, a study I was involved in many, many years ago in psychiatry, looking at treatment study for depression, where as a side study, we looked at a concept called the, well, let's see, I've forgotten the name of the concept, but it was basically the amount of rapport that the patient felt that they had initially with their therapist. And we found it to be actually quite predictive of improvements in depression over time, above and beyond any treatment effects. So if anyone would like to adapt this idea for your own studies, I'd go ahead and do it. So let's see. So in this slide, I'm just listing briefly the some of the problems that can go wrong in a study, and then in the remaining slides, I'll review these in more detail. So these are all really pretty common problems. So 2 different categories. One is measurement error, and the other is what I call sample problems. So measurement error is just misinterpreting questions. And so when you write the question, you think that the respondent is going to interpret it one way, but they actually interpret it to mean something else. And that can be true even for things that you consider to be relatively simple questions that actually are maybe a lot more complicated than at first seems to be the case. So a couple of examples nowadays would be questions on, what is your sex? What is your gender? And what is your sexual orientation? What is your race? These are actually pretty complicated questions because people have used terms differently, and sex versus gender, for example. And if you go into this assuming that your respondents are going to interpret it exactly the way you're interpreting it, you may wind up with really, really bad data. So another issue is individual differences in interpreting the questions or response options. So this would be the case where someone is interpreting the question in a reasonable way, but the question is somehow vague, is a little bit vague. Where often what I'm referring to here is where the response options can be interpreted differently by different people. So an example would be a liquor type item where the responses are, 1 means not at all, and a 5 means a lot. Well, a lot can mean different things to different people. So 1 person's a lot might be another person's 4 or 3. Let's say the question was, how satisfied are you with, the care you're getting? And again, the person may, really like their care a lot, but they tend to not use fives, they would use a four. So that's going to lead to measurement error. It may not be major measurement error, but sometimes it can be quite substantial. Sometimes what you're trying to measure is something that can't be measured directly. There is no gold standard for it. And I'll talk about this on later slides. Another very different kind of problem is not reading the questions and or response options. So here I'm talking about the case where people are actually not being truthful. They are pretending to actually read the questions and answer them, but they know they're getting paid $10 for completing a survey, and they want to do it as quickly as they can. And they go through it and they fill in dots without even reading the question. Then sampling problems, sample size too small, selection bias is very common in surveys. And sometimes we would like to answer a question about a population that requires a degree of precision that can only be achieved using what's called a probability-based sampling plan. And typically that's very expensive to implement. It would be extremely unusual, for example, in a CFAR pilot study, for someone to initiate a probability-based sampling plan, but it is conceivable. Again, the reason why it's not common is because it can be difficult to implement, and in many cases just impossible to do. So you rely on convenient samples. And the final problem here is excess missing data. And here I'm talking about the case where someone starts to complete a survey but doesn't finish it, or leaves a lot of the answers missing. If that's amount is high, that can lead to problems of statistical power as well as interpretation problems. So let's see, hold on a second here. Okay, so how do we prevent measurement error problems? So I'm going to talk here now, but go through the slide, but do feel free to interrupt me, and if people have other ideas they'd like to add for discussion, that would be great. Overall, I think maybe 12 slides here, and they're kind of packed slides, so it's more than enough for me to talk for the full hour, but I'd actually rather not talk the whole hour and have people give comments, and even if I don't make it through the whole list of slides. Okay, so preventing measurement error problems. So these are all basic things, and I apologize. I know some of you are very familiar with everything here, but the review hopefully will be useful. So one thing that is recommended is to use standard published survey items. So an example would be the items and scales that are provided by the NIH-funded PROMISE program. They have, I haven't looked at it in a long time, but they used to have many, many items that are used in a lot of research studies. They do it, the items that they include have had evidence of working pretty well, good reliability and validity. And and the NIH, for many, many years has been encouraging researchers to use items that would allow combining results from multiple studies and multiple investigators into meta-analyses and things like that. And by having standard approaches to measuring the items, such as demographics, it facilitates that. The NIH also has some other guidelines, which I remember looking at a couple of years ago on, they weren't quite guidelines, they're just sort of more thoughts they had about measuring things like sex and gender and how to think about those concepts. It may be outdated by now because these concepts do change in our society over time. Second idea is pre-testing. So ideally, you'd pre-test with, 10 or 20 or 30 people. For most studies, that's way too much time. If you can only pre-test with 1 or 2 or 3, well, that's better than 0. So basically, the more that you can pre-test, the better. There are formal procedures for modifying test items called cognitive testing. Please don't ask me any questions about cognitive testing. I'm a statistician. Cognitive testing is not part of my experience or training, but there are people who are very familiar with those techniques. I don't know for sure who's providing services in the social and behavioral sciences core and what their skills are, but it wouldn't surprise me if there's someone there with those skills or could provide a referral to someone with those skills. Or Chingpan, who's the current biostatistician with the CPS Core, she might know someone. Another thing to consider would be adding detailed anchor points for liquor type items. So an anchor point description would be one where you're just instead of saying, well, a 5 means not at all, or 1 means not at all, and a 5 means a lot. You would provide more description about what you mean for those anchors. And usually that's not feasible if you have a long survey instrument, because your instrument would go from being 5 pages long to 15 pages long because of all the added explanation. My recommendation would be to consider including detailed anchor points for items that are really very primary to your study, primary to your hypotheses, not questions that are sort of, well, it'd be interesting to know about this. It'd be more like, well, we really want to test this. And in particular, those where there are no standardized items that measure that available already. How do you increase the likelihood the respondents will read the questions and the answer choices? Well, you need to provide strong motivation in people. And again, this is not my expertise. Some of it is just sort of common sense, but some of it is talking to people with experience with motivating people to do surveys. And some people seem to have that skill. What I would suggest at the least is providing, getting a strong introductory letter or statement by community leaders or peers, someone for whom you're pretty sure that almost every potential participant, if they saw that name, would say, oh, yeah, I trust this person. This person, if they're asking me to do something, I should consider doing it. I think it's, in my experience, if the research staff have great communication with the participants, if it's the kind of survey where there's actually, direct talking to participants, then that can, if they're just really good at it, if they're very respectful of the participants, they really make the participants feel really good about being in the study, as opposed to, hi, we have a survey to complete. Would you mind doing it? Here's the informed consent form. if it sort of goes way beyond that, that can really make a big difference. And then I also list adequate gift or compensation for your time, although, as I'll mention, I think in a later slide, that can backfire, particularly for internet surveys. But you know, it is work in a sense for people to do surveys, and if it takes a bit of their time, it's, you know, it is reasonable to compensate them for it. I know that all PIs are always worried about your budget, and you know, the more you put into that gift category, the less there is to pay the really important people like the statisticians, etc. But you know, that's just sometimes you really need to do that. Avoid overly long, tedious surveys. No one designs a survey to make it tedious, but that's just the way it happens. And make sure that, you know, you show that the survey to other people who are objective, and you say, if someone asked you to complete the survey, you know, do you feel really, you know, annoyed by the end of the survey that you've been asked to spend that much time on it? I think that's where the money comes in handy, because in a sense, if it's tedious, you're paying them to put up with that, and that's reasonable in that case. So another option which I've seen elsewhere in surveys, long surveys, is to add, say, in the middle of the survey, a question that says something like, you know, the next survey question is, what is the survey about? And so here at the bottom are 3 answer choices, you know, this favorite movies, how you feel about taking your HIV prevention medicine, or what do you think about your health insurance? And you know, you could have 5 options or 6, and you know, only one of them is correct. And if they check off the wrong option, it doesn't solve the problem, right? But at least you know that you can't trust that individual's responses to the survey, because they're not, at least at that point in the middle of the survey, they are not paying attention anymore. So again, I've seen this in other sort of commercial surveys, and my assumption is that it is pretty effective for that purpose. So how do you evaluate measurement errors? So that's where reliability and validity assessment come in. So I'm going to be really, really brief here. And if there are some detailed questions about it, if there's time, I'll be happy to answer those later.
Sam, Alan
yeah.
has a question or a hand up. Alan?
Yeah, just very quick, Sam, you said we could interrupt you, so I
Sure.
will. First of all, my own personal favorite is keep it short, because having reviewed so many surveys in my career, I just find if you can get it to a reasonable number of questions, it's most respectful to the time of your participants, and the less likely they're just going to check off answers to get to the end. And then another kind of error we've seen a lot of, a couple of examples of in the CFAR has been when people put surveys online, and I guess they have people scroll, you know, going around the internet trying to pick up incentive fees and trying to fill out surveys willy-nilly. And I don't know if you've had any experience with that.
Yeah, I have seen that happen. And in one survey several years ago, the it practically destroyed the survey. There are so many people who are essentially scammers, and people who should not have been completing the survey. And the person I was working with, the investigator, later for another survey had said she had some solution to it, but I don't remember what the solution was. So if anyone here on this call has heard of a solution for weeding out and preventing scammers in internet surveys, please speak up now.
Blair, are you able to unmute? Because I think you
Yeah.
worked on this a little bit and you got help from the CFAR to address this for one of your studies?
I did. I got help from Sarah, and I don't want to mispronounce her last name, Calabrese. She was very, very helpful when we did our survey with the DC Health Department. So there's actually ways when you develop your survey and put, like, for example, we use Qualtrics. So there's ways you can use lockouts, so you can make it so it's limited to certain areas, like only people in the US or only people in a certain locale are able to access the survey. You can do lockouts for based off of like multiple IP addresses, and you can even put in CAPTCHA codes as well. So you have to, like, click on, but they're like the things that you do when you go on like Amazon or something, where, you click on all the traffic lights or click on all of the bicycles that prevent some of that. It's not 100%, but I think it does weed out a lot of the scammers in those surveys. But I think Qualtrics is very good with that. I'm not as familiar with RedCap, but I think it does have some of those checks in there as well.
Oh, that's fascinating. I hadn't heard all those different kinds of interventions. It strikes me that it takes tech to fight tech. If you need to have a certain degree of savvy in order to, or help with someone with savvy to help you negotiate all those different barriers.
Yeah, I think so. And I think as people become more sophisticated, the tech to fight it may be needed to be more sophisticated as well.
That's
Uh, Thank you, Blair. That was good to know.
Thank you, everyone.
So, let's see. So for reliability assessment, a pretty basic one is sometimes called test-retest reliability. And so if you're doing a single one-time survey, sometimes people will include the same question at the beginning of the survey and at the end of the survey, and see how well they match up. And if it's you can look at the correlation between the two, if it's a continuous variable or kappa statistic, if it's a binary variable or some variation on the kappa, to do that. Obviously, you can't do that for all the items in a survey. You would do it for items that you consider to be, absolutely essential, absolutely vital to your primary research questions. If you have a repeat longitudinal survey, then it's much easier to just repeat questions. The initial survey, and then the 3-month survey, and the 6-month survey. For some questions, you might expect that there would be no change at all over time. And so in that case, the reliability coefficient, between time 1 and time 3 is sort of an absolute measure of reliability. In other cases, you might expect that there'd be some change, but not a lot. So you wouldn't expect to have a perfect reliability score. If you're expecting a lot of change, then it's still worthwhile doing that kind of assessment, but it's no longer really truly a reliability assessment because it's being influenced by change. The other very common type of reliability assessment is sometimes called internal consistency reliability. And that's when you have multiple items that form some sort of scale. The most common of these is, of the statistics, is called coefficient alpha. It's been around for probably about 50 or 60 years, very widely used. Although it's widely used, it ranges from 0 to 1.0, where 1.0 is perfect. You do have to recognize, though, that interpreting the absolute value of the coefficient alpha is actually pretty soft. It's pretty loose. So usually if you have an alpha of 0.95, most people would say, yeah, that's great. If you have an alpha of 0.80, well, some would say, oh, that's pretty good. Others would say it's not so good. So it's a bit more subjective. But it's still worth doing and reporting in a journal. And as part of that internal consistency reliability, it often comes with sort of as a side outcome, an item analysis that can help you determine whether certain items just don't fit well with the other items, because essentially they're correlating very poorly with the other items. So on that basis, you might decide to drop an item. Then there are lots of more advanced methods, which I'm not going to talk about today. They're probably in most cases not essential to use. Confirmatory factor analysis, item response theory for determining which items are best. So validity, I've sort of broken this down into two different kinds of validity assessment. One is when you have what's called a latent construct. And a lot of this thinking behind this actually comes from behavioral sciences.
Oh, sorry. Oh, can I ask a question?
Sure.
Previous slide, can you go back one slide about the test retest? And this may be a basic question. But when you're doing your test retest, do you literally ask the same question, or is it reworded in some way to make it a bit different? Like if you're doing your test retest for a reliability assessment?
Yeah, good question. So if you wanted to be sort of a pure test retest, it would be the same exact question. But if you're changing the wording, then it actually becomes almost more like a validity type question, which is just as important, if maybe not more important. So going to this next slide where I'm talking about latent constructs. So if the wording is changed, it's sort of, you're implying that there's something underneath the question that you're trying to get at, but there's no single question that absolutely answers that absolutely assesses that construct. Instead, there are multiple ways of sort of getting at that construct. And those might involve different ways of wording the same question. So I would say that in terms of, what should you do? Should you have changed wording at the end of the survey? I think actually that's not a bad idea. Because also if you ask the same exact question twice in the same survey, the respondent may remember the first time that it was asked. So there's a little bit of kind of a memory effect, and also, and then this is just speaking from my experience as someone who completes surveys at times. I find it annoying when people ask the same question twice in a survey. So you don't want to annoy. There are too many surveys out there that at least I find annoying, and you want to minimize that. Sort of getting at Alan's advice to not make the survey, keep the survey short because you don't want to annoy people.
Just Sam, on that note, some of these are incorporated in many of the Max and Weiss studies, but we've had to consider including an explanation for why we have the repeated questions, but not just for our participants, but also for our interviewers who think that, oh, you guys missed it, you already asked this. So there's a good amount of training that has to go both for those taking the survey as well as those administering it, if it's interviewer administered, because people really do complain.
Yeah, well, and that's a real cost to the survey because it's extra time and training, which no one likes to do that. and extra time and explaining things. So that would be a reason to not have them twice. So the kind of the broad term in the behavioral sciences is construct validity, which essentially means that you'd want to find that concepts that should be correlated together, or measures that should be correlated together theoretically, are in fact correlated, maybe correlated pretty highly. And, maybe things that shouldn't be correlated should show up as a close to zero correlation. So it's actually it's an extremely useful concept, but explaining it in a very, very brief tutorial like this is probably beyond the scope of what I can provide. But if, let's say, you take the example I gave earlier of a study that's looking at rapport, self-reported rapport that the patient has with their provider or healthcare team. Where one means that the rapport is, they were very unhappy, and 5 means that they were thrilled with the care and support and respect they got. You could ask the same thing perhaps of the healthcare team, or someone in the healthcare team, or everyone in the healthcare team, to rate that patient and say, how happy do you think that patient was, with the service we're providing? Now, obviously, that's only going to work if the providers have enough contact with the participants in the survey to actually, be able to make some judgment about that. If they're seeing them for, 5 minutes once every year, they may not, it's kind of pointless to do that. But if they actually had a fair amount of contact, then construct validity would say, well, there's two measures of the patient's rapport with the provider healthcare team should correlate, at least moderately high, if it's being measured the way you think it is. If it's essentially random noise, then the correlation would be 0. So that would be an example of using 2 different methods to measure the same thing and see how well they correlate. In medicine, you could have something like that with measuring, systolic blood pressure from your left arm and your right arm, or something like that. That would be an example of that. So it doesn't give you, again, it doesn't categorize a measure as being valid or invalid. It could be, in theory, completely valid if the correlation was, near perfect, or it could be completely invalid if the correlation is near 0. But in most cases, you're going to find some range in between, and there'll be multiple correlations, so you really can't reduce it to sort of a single, yes or no, this is valid or not. It's a matter of degree. Now, if you have a gold standard or something more objective, then you can try matching the self-reports by the patient against these gold standards, or objective, quote, objective things that are in electronic medical record, recording device, let's say for medication adherence. You ask the patient, well, how often do you take this drug? How often do you miss taking it? And then you see how well that matches up to some sort of fancy electronic pill counting device or something. But many times doing that kind of correlation with a gold standard is not feasible for a small study, or even sometimes a large study, just because of the costs involved in assessing the gold standard. Or in doing blood tests, for example, maybe you just don't have enough money to do it for everyone. So in that case, what's often done is you take a random sample of the participants and you do the blood tests on that random sample, or you give them the pill counting machine or some other fancy technology that you have. And you see, and you come up with an estimate of the correlation of the construct validity based on that subsample. If the sample is too small, it's not going to be helpful. If you have, 5 people, it's probably not worth doing. If it's 20 or 30, yeah, that's getting into something where at least you have at least a crude sense of how much agreement there is. Let's see. So statistics for binary variables, the gold standard, typically their percentages or basically some variation on screening statistics like sensitivity and specificity. That sort of statistic that's useful. 80% of the people who were found, who were fully adherent with their medicines based on the gold standard were reported that they were fully adherent as well, something like that. For continuous measures, there's a statistic that's pretty uncommon. Most people have never heard of it, but it's pretty handy. It's called the Bland-Altman procedure. It's not difficult to implement. You might just want to make a note of it someday. If you decide to use it, you can look up the procedure. It's a pretty intuitive assessment of agreement between what your continuous measure and what the gold standard is. So fixing problems. So let's say you've done a survey and for some key questions, you're able to see if they're inconsistent with other questions in the data. Kind of a classic example would be if well, let's see. No, that won't work. If someone right. So for time of diagnosis of HIV, for example, you ask, in what year were you diagnosed with HIV? And then you have another question that asks, when did you start your HIV medicine? Well, if they started their medicine before they're diagnosed, that's probably a sign that something's not right there. These kinds of consistency problems it's rare actually that a survey is able to sort of detect these inconsistencies, but you should think about if there is something in your survey that would allow you to sort of flesh those out and find those people who have inconsistent results. Sometimes you can go back, and so if it is inconsistent, you want to change it to missing, or if you're are somehow able to go back to the original respondents and call them up or send them an email and say, hey, I'd like to talk to you about your answers to questions 5, 6, and 7 on the survey. Can we do that? Then sure, go ahead and do that. For most studies, that's not really feasible, or you can't, or you'd be violating confidentiality issues if you were to do that, or something like that. But sometimes it's possible to do it, and if it is, having that conversation with the person could be a way of correcting it. Again, that would be particularly important for key variables that you really want to focus on. Sometimes you find that your reliability statistics are really poor for a particular measure, and It's not, personally, I think you just need to drop it. Hopefully that's not the key question in your whole hypothesis and doesn't depend critically on it, but occasionally that does happen. And sometimes it's possible to kind of get a sense as to from the data as to whether certain people are providing invalid data generally. And I've seen surveys where you're looking for extreme responses that should be very rare, that are checked off all over the place, or a pattern of response where it goes, you know, the answer to question 1 is A, to B, 2 is B, to 3 is C. They're just sort of going down the list. You know, usually you can't be 100% sure that the data are bad, the person made up the answers without paying attention, but sometimes you just have a, you know, a reasonable suspicion. So the way to handle that is to do what we call a sensitivity analysis, which is that you analyze the data, including those suspect survey respondents, and you also reanalyze the data, dropping them. And you're keeping your fingers crossed. You're hoping that the main conclusion that you draw from the analysis remains the same, regardless of whether or not those people are dropped. Now, you might say, well, what happens if the results really do change? Well, that's an indication that there's just a lot of uncertainty. There's more uncertainty in the results than you'd like. And personally, I think that should still be reported. And that the discussion section of the paper should say, you know, well, we found if we, you know, included all these suspect people that, you know, we've proven our hypothesis, but that wasn't the case when we dropped them. Therefore, we have less confidence than we'd like in our, you know, in our hypothesis. And the same would be true, for example, if you're running into very serious outliers on important questions. You're not sure if the outlier represents a real value or just someone who's just, you know, has an extremely high viral load or whatever. Questions about that? Almost done here.
I have a question. Can you hear me?
Yes.
So, I mean, I think it's obviously pretty subjective to try and figure out who's not answering the questions faithfully, and, you know, everybody can see probably a different pattern. I wonder, you know, in the advent of AI, whether people are looking at programs, AI programs that would be very much better, and, you know, depending on the size of the survey, also much can analyze the data so much quicker than, you know, say you have 300 respondents and trying to look through everybody's responses and look for patterns that suggest that, you know, the person was filling it out wasn't doing it faithfully. I just wonder if you know of any AI tools that are helpful for researchers to do that.
I don't. I think it's an interesting idea. Certainly using statistical methods like AI, not necessarily the newest AI tools, can be used to try and identify people, but I've actually not seen that done either with AI or other statistical tools, but in theory, I think it could be. I think it would what you would probably have to have is include a certain number of surveys that you sort of seeded into the batch that were purposely fake surveys, and to identify them to AI or whatever statistical tool you're using as being fake. And AI could then say, look for patterns that say, oh, you know, the patterns that we're seeing in these faked, known faked surveys, we're seeing those in, you know, 15 other surveys in the batch. But in the end, it's even for AI, it's still going to be guesswork. You know, it'll be a probability essentially is what it should be, providing a probability that this is fake or not. But
Yeah.
yeah,
Okay.
interesting idea. You know, if you think there's only, you know, if you're doing a survey of 300 people and you think only 2 or 3 of them were fine, or even 10 are bad, that's unlikely to affect your results very much. So you probably shouldn't worry about it too much. You know, it's just another source of measurement error. If it goes above that, that's when I get concerned. But again, that's where the sensitivity analysis would help you out, because if it's a small number of suspect cases, unless those cases, those surveys are remarkably different than the others in terms of your hypotheses, chances are it's not going to change your conclusion very much. Let's see, I think I just have this one last quick slide here. What time is it? Oh, it's almost 5, almost 6. So this is sort of more statistical questions, but you know, if your sample size is too small, selection bias. So there are methods for determining what the sample size should be for a study involving a survey. We're estimating something. It's usually based on the confidence interval. The larger the sample size, the more narrow the confidence interval. So if anyone needed help for that, Dr. Pan, I'm sure would be happy to provide that. I think she said she's away for the summer or something, but
Yes, she's traveling at the moment.
when she comes back, you know, or a power calculation first. If the non-response is often very high. That's why I bolted that in my experience. And you know, we're always underestimating how many people are just not going to either not be reachable, or they're reachable and they just don't want to be bothered. I think might even be getting worse. I know I find I'm turning down more surveys because I'm getting bombarded by too many commercial surveys. And I think that unfortunately affects everyone's motivation or lack of motivation to complete these. So the second bullet is one that I think Alan raised already. We already discussed with Blair, the scammers for online surveys. And if you need if you do need a sort of a population based, an unbiased, precise estimate for a very defined population, you know, what is the proportion of PrEP, you know, people who are using PrEP who stick with it 1 year later, you know, is it 29% or is it 78% or is it 23%? And you want that to be fairly precise. That's where you might want to consult a survey statistician to get a probability-based survey sampling plan. And that's the end of my slides. Any other questions, comments?
Alan has his hand up.
I wanted to give other people a chance, but Sam, since you're back, you're fair game for questions, so it's great. This was extraordinarily practical and helpful. Thank you. I learned a lot. One question that always comes up is how much is enough? As you just said, in this day and age, people are so survey overwhelmed. Every time you buy anything online, anytime you stay in a hotel, take an air flight, you get a survey. And so people are sort of sick of surveys. And yet there are some surveys that are really important. Let's say we were surveying our graduate students about how they enjoyed their experience in the program. You'd really want to know, and let's say there were 50 of them. You're not going to get all of them because people are just sick of surveys. But I know you could calculate it statistically, but what's your gut? How many is enough before it's so unrepresentative that it just becomes random? Is there any way to look at it either qualitatively or quantitatively? Because in this day and age, if you can get half the people to respond to the survey, that's great, but it may not be representative in any way. So what are your thoughts about that?
Yeah, no, it's a tough one. Bias. So the selection bias is the most serious problem. I don't think it's actually typically that serious if your research question is looking at correlations. You're predicting something because even if you're missing people at a higher rate at one end of the question, that you're as long as you have enough variability in the selected people, that your estimate might actually still be pretty good with even with losing half of your sample because of in a somewhat biased way. Where it becomes really serious is if you're trying to estimate a simple quantity. Again, you're trying to estimate what proportion of people are, adherent to their PrEP medicine in a population, unless it's a very small defined population. I think ultimately, sometimes we're in a position where we can compare the people who are in the study who complete the survey to those who don't on demographic data. So an example of that is if you're getting your data from, say, the DC cohort, and you're contacting 200 people out of the cohort with surveys that ask for additional information. If you can do it in a way that gets around confidentiality issues and IRB issues, you can at least see, well, are the people who you contacted radically different, depending upon whether they took the survey or said no to the survey. If they're radically different, then you just want to think about, well, how might that affect the results? Sometimes you might conclude that, yeah, they're radically different, but it's in a way that's probably not relevant to the research hypothesis. But it's always a guess at that point.
Thank you.
Well, if there are no other questions, we are at the end of our time. Sam, thank you so much for a great presentation. You always make things very clear for all of us, and the recording will be available. I'm sure many people will refer to it, so we'll make sure that it's available online.
Okay, thanks again for the invitation. Good to see everyone.
Thank you, Sam. Thank you, and thank you
Thank
everyone
you, Sam.
today. Okay, have a good evening.
You too.